Hello everyone, this is Meteor Academy, one of the leading academy in training nurses in their competitive exam as well as IELTS and OET training, and also we are performing abroad nursing placement services. So if you want to know further, you can contact us in the given phone number or mail ID or address given below. Let's begin the session. And today we are going to discuss about the practice questions related to NORCET upcoming exams. If you like this video, please like it, share it, subscribe it, and don't forget to click on the bell icon. The first question is, management of wernickes disease and beriberi involves the administration of, the option given here are iodine, vitamin A, vitamin C and thiamine. And the correct answer here is option D, thiamine. The next question is, acid-fast bacilli are found positive in which of the following condition? Option given here are TB, SARS, TB and leprosy. And the last one is diphtheria. And here the correct answer is option C, tuberculosis and leprosy. Next question is, which part of the mind is associated with practical reality principle? The options are hyperego, superego, ego and id. And here the correct answer is option C, ego. Next one is, the maintenance provided by a husband to his divorced wife is called. The options are mahr, bride price, alimony and dowry. And here the correct answer is option C, alimony. The next question is, bleeding precautions like needle stick injury prevention should be followed in all of the following cases except. The option given here are on cephalosporin, suffering from hemophilia, suffering from liver disease, on anticoagulant. And here the correct answer is option A, on cephalosporins. The next question is, the borehole Latin was introduced in India by. The options are Rotary Foundation, Rockefeller Foundation, UNICEF, Melinda Gates Foundation. And here the correct answer is option B, Rockefeller Foundation. The next question is, hypertonicity and scissoring leg movements are expected clinical findings in. Options are autism, cerebral palsy, mental retardation or schizophrenia. And here the correct answer is option B, cerebral palsy. The next one is, the philosophy of education in which the treatment of thing is based solely on the practical utility. Underline the word practical utility is called. The options are realism, idealism, naturalism, pragmatism. And here the correct answer is option D, pragmatism. The next one is, the Hawthorne study to determine the relationship between the intensity of illumination and worker productivity was done by. The options are Elton Mayo, Abraham Maslow, Kurt Lewin, Mary Parkler, Follett. And here the correct answer is option A, Elton Mayo. The next question is, the art of applying mock injuries for the purpose of training emergency response team and other medical personnel is called. The options are exhibit, specimen, moulage, model. And here the correct answer is option C, moulage. The next one is, a patient with chronic renal failure is receiving Epoetin Alfa. Which laboratory result would indicate a therapeutic effect of the medication? The option given here are hematocrit 32%, platelet count of 4 lakh cells per millimeter cube, WBC count of 6000 cells per millimeter cube, and the last one is BUN of 15 mg per deciliter. And here the correct answer is, we have to check the hematocrit 32%. Answer A is the correct answer. The next question is, the leadership style developed by Kenneth, Blanchard and Paul Hersey based on task and relationship behavior is known as. The options are effective leadership, transformational leadership, charismatic leadership and situational leadership. And here the correct answer is option D, situational leadership. The next one is, which nursing intervention is appropriate to prevent the pulmonary embolism in a patient who is prescribed bed rest? The options are encourage deep breathing and coughing exercise, teach the patient to move legs in beds, use the knee gauge when the client is in the bed, limit the patient fluid. And here the correct answer is move the legs in the bed. The next one is, while asking about the history of a patient, the nurse finds out that the patient is on a plant-based diet only. She understands that he might develop. The option given here are pellagra, megaloblastic anemia, scurvy and marasmus. And here the correct answer is option B, megaloblastic anemia. The next question is, perinatal death include death during? The option given here are 37 weeks of gestation to 14 days after birth, 0 to 1 month of age, 0 to 28 days of age, and the last one is 28 weeks of gestation to 7 days after birth. And here the correct answer is option D, 28 weeks of gestation to 7 days after birth. The next question is, an 18-month-old infant hospitalized with a severe asthma attack is given prednisolone 15 mg per oral BID. The nurse should, the options are, check the child eosinophil count daily, have the child rest as much as possible, prevent exposing the child to infection, keep the child NPO except for medication. And here the correct answer is option C, prevent exposing the child to infection. The next question is, a 75-year-old patient has dementia of Alzheimer type of confabulates. A nurse should understand that this patient, options are, pretend to someone else, denies confusion by being jovial, fill in memory gaps with fantasy, rationalizes various behaviors. And here the correct answer is option C, fill in memory gaps with fantasy. The next one is, what would you monitor in a patient taking high doses of acetaminophen over a prolonged period? Easy question, and here the option given here are liver function, GI irritation, prothrombin time, kidney function. And here the correct answer is option A, liver function. The next question is, the name of the nursing diagnosis is linked to the etiology with the phrase. The option given here are as manifested by, related to, evidenced by, due to. And here the correct answer is option B, related to. The next question is, the movement of the head and shoulder is controlled by the options are abducens nerve, accessory nerve, hypoglossal nerve, glossopharyngeal nerve. And here the correct answer is option B, accessory nerve. It is a 11th cranial nerve. The next one is, which of the following communication techniques should be avoided by the nurse? The options are belittling, validating, reflecting and listening. And here the correct answer is, as a nurse we should avoid belittling. The option A is the correct one. The next one is, modern concept of chemotherapy was proposed by. Options are Joseph Lister, Metchnikoff, Paul Enrich and Frackel. This question asked in AIIMS Nagpur Nursing Officer Exam 2020. And here the correct answer is option C, Paul Enrich. The next one is, which among the following is correct among chemotherapy? The options given here are, it is most effective against smaller tumor with slowly proliferating cells. It is more effective against larger tumor with rapidly proliferating cells. It is most effective against smaller tumor with rapidly proliferating cells. And the last one is, it is least effective against smaller tumor with rapidly proliferating cells. This question asked in RUHS Nursing Entrance Exam 2013. And here the correct answer is option C, it is most effective against smaller tumors with rapidly proliferating cells. It is because chemotherapy drugs attack rapidly dividing cells only. The next question is, Among these, which drug is cell cycle specific antineoplastic medications? The options are cisplatin, methotrexate, cyclophosphamide and chlorambucil. And here the correct answer is option B, methotrexate. Rationale behind this is cell cycle specific antineoplastic drug affect the cancer cells during a specific phase. Underline the word specific phase of cell cycle. Example, methotrexate affect during S phase and alkaloid affect during M phase. See, cell cycle non-specific antineoplastic drug affect the cancer cells during any phase of the cell cycle with the example cisplatin, cyclophosphamide, busulfan and chlorambucil. So dear everyone, till now we discussed all the direct questions which is asked in previous year exams. See, this is almost very important questions which is very essential for updating yourself for upcoming NORCET exams. So guys, please follow our videos. If you like our videos, please like it, share it, subscribe it and don't forget to click on the bell icon. Thank you very much once again. If you want to contact us, you can contact us in the address, email ID and contact number given below.